Yeah, I'll react to that, sure.
Uh, this is close. Hi, guys. Jeez, stop it. Okay, that's just as big. All right, guys. I like watching these, healthcare, gun laws, policy differences between the U.S. and European countries or other countries in general videos. I might not be that knowledgeable, but that's why I like to learn more about it. So, original link to the video, top of the description. Let's see if I can talk and fix the background at the same time. Original link to the video, top of the description. Right below that, link to the Discord. Click on it, sends you right over there. We'd love to have you. And that is how we do it. Almost. All right. Hi, guys. Let's go. Let's go. Let's go. Now. You can't even hear it. Ah. There we go.
U.S. healthcare system. 70% of Americans say the U.S. healthcare system is in a state of crisis or that it has major problems. That's why we're hearing a lot about Medicare for All, including some plans going as far as banning private health insurance companies altogether.
This has been a horrible intro, but I'm not restarting. But everything is set. I'm ready to pay attention. Go.
70% of Americans say the U.S. healthcare system is in a state of crisis or that it has major problems. That's why we're hearing a lot about Medicare for All, including some plans going as far as banning private health insurance companies altogether.
On page 8 of the bill, it says that we will no longer have private insurance as we know it. And that means that 149 million Americans will no longer be able to have their current insurance. That's in 4 years. I don't think that's a bold idea. I think it's a bad idea.
Problem, Senator Sanders, with that damn bill that you wrote and that Senator Warren backs is that it doesn't trust the American people. I trust you to choose what makes the most sense for you, not my way or the highway.
One country found a way to provide universal health care coverage while maintaining a competitive insurance market that offers citizens more choices. Germany. Here's how they did it.
Let's learn.
In 2017, U.S. healthcare spending came to around $10,200 US per capita. In Germany, it was a little under $6,000. Overall, Germany spent about 11.2% of its GDP on healthcare, while the U.S. spent 17.1%. Germany manages to cover 100% of its population. In the United States, about 8.8% of the population remains uninsured. That comes to about 28 million people, with even more people underinsured. Despite spending less, Germany has better or comparable health outcomes to the United States. Studies show that in Germany, there were fewer deaths that could have been prevented with proper access to care. In 2013, there were 83 avoidable deaths out of every 100,000 people in Germany, while the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States. 103 avoidable deaths out of every 100,000 people in Germany.
I'm curious what the statistic would be for the avoidable deaths per 100,000 deaths. I'm curious what that would be. I don't know if it'd be a better way of. I'm sure it's sort of the same thing. It's per capita. I'm sure it's similar.
While the United States had 112. Life expectancy in Germany is 2.5 years higher than the United States, and the infant mortality rate is lower in Germany, with 3.3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States.
Why is that? I don't want to pause too much, but I really want to know why the infant mortality rate is. Well, Mexico, geez. I really want to know why the infant mortality rate is so high in the U.S. I mean, because like I understand if when you get in debt. I mean, so is that literally people who don't want to pay for hospital stays, who then, because they're afraid to pay the 10 grand? I've never had a child. I don't know how much it is to for the bed and the service of delivering the baby and everything. The service of delivering the baby. That sounds American. But yeah, I'd really like to learn more about why the infant mortality rate is so high in the U.S.
3 deaths per 1,000 live births, as opposed to 5.8 deaths in the United States. Additionally, the maternal mortality rate in the United States is more than 2 times higher than in Germany. So how does Germany manage to have better health outcomes while spending nearly half as much as the United States?
Germany is a system that would look familiar to Americans in that everybody buys health insurance from a private company. And then the doctors and the hospitals and the labs are almost all private.
That's T.R. Reid, author of the book, The Healing of America.
Private company. And then the doctors and the hospitals and the labs are almost all private.
That's T.R. Reid, author of the book, The Healing of America. He traveled the world exploring different healthcare systems and how well they worked.
But it works better in Germany for a couple of reasons. One is everybody is covered. Everybody is required to have insurance. Everybody's in the system. The insurance companies can't turn you down because you had cancer last year or something. They have to take you. They have to cover you. Everybody has access to the same treatment, and all the doctors. You can go to any doctor without any limit set by the insurance company.
In Germany, health insurance is mandatory for all citizens and permanent residents. There are 2 different systems that residents can turn to for insurance. SHI.
I should have peed before I started this. I got to pee quick, and then I'll be right back, and I have a question to ask. So this is a fine, quick break here. Okay, sorry, I'm back. I'll wash my hands.
Which stands for Statutory Health.
I had a question, though. Oh, yeah. So for infant mortality rate, do you think that's because people are like so afraid of like the cost of an ambulance, or even if like your husband is driving you there and you don't have to have the ambulance cost of getting there, but it's gonna cost money to get a room in the hospital? It's almost like hospitals are like fancy hotels in the US, which is kind of sad when I say it that way. Jeez. Like, so I'm wondering if people in the U.S. are so afraid of going to the hospital for the bill that they're just like, let's avoid that and have a birth at home. And then because you don't have all the technical people, there will be more mother and infant mortality rates. Because no, not good.
Systems that residents can turn.
But let me know if you guys know the real reason or.
Citizens and permanent residents. There are 2 different systems that residents can turn to for insurance. SHI, which stands for Statutory Health Insurance.
I'm going back.
Has access to the same treatment, and all the doctors. You can go to any doctor without any limit set by the insurance company.
In Germany, health insurance is mandatory for all citizens and permanent residents. There are 2 different systems that residents can turn to for insurance. SHI, which stands for Statutory Health Insurance, and PHI, or Private Health Insurance. German citizens are eligible for PHI if they make more than roughly $60,000 per year, or if they are self-employed. Citizens making under that threshold must pay into SHI. SHI is made up of a network of competing not-for-profit private health insurance funds, known as sickness funds. In SHI, dependents are covered free of charge, and monthly costs are capped around €840 per month. Even though SHI sickness.
Okay, so if you make under 60,000 a year, then you can apply for the more. That makes sense. It would be kind of annoying knowing that taxpayer dollars are also going to like the super wealthy who have no issue paying for the insurance. But okay, yeah, guys, in these videos there's gonna be pausing and stuff. Okay, I just
SHI.
Get over it.
SHI.
I want to understand here.
Is made up of a network of competing not-for-profit private health insurance funds, known as sickness funds. In SHI, dependents are covered free of charge, and monthly costs are capped around €840 per month.
Monthly costs are capped around €840 per month. So that means for the higher earners in that $60,000 range, you can only get $840 of free healthcare per month.
Even though SHI sickness funds are not government agencies, many Germans think of them as part of a public system because of heavy regulation. Keith Tanner helps expats navigate the German healthcare system, and he considers SHI sickness funds quasi-public organizations.
Basically, they have to do what they're told. They are told by the government in what range they can charge. They're told what health procedures they can fund, and they are told by the government who they can accept as clients. So they're really just carrying out orders.
They're basically charities. They don't exist to make a profit for investors like American health insurance companies. They're there to keep people healthy. That's what they're there for. They follow all sorts of rules that American insurance companies wouldn't dream of.
The system is funded through...
I'll go back to it, but I really think I missed the point and was confused about that 60,000 range, but I'll go back after the end.
Compulsory contributions based on a percentage of citizens
wouldn't dream of.
The system is funded through compulsory contributions based on a percentage of citizens' salaries, with employers sharing the costs. There are also built-in safety nets. The government will pay into SHI on behalf of the long-term unemployed. Despite being non-profit organizations, sickness funds compete for customers by offering specific coverage and perks. This competition has changed over the years as the system has allowed citizens more choice. As of 2019, there are about 100 statutory health insurance companies, but there used to be many more. When Germany's system was first established in the late 1800s, sickness funds were linked to a person's profession. It first established in the late 1800s. Sickness funds were linked to a person's profession. It used to be that people were assigned to a specific sickness fund based on their occupation or region. Now Germans can choose where they enroll, and they can change funds on a yearly basis. As a result, sickness funds began marketing themselves in order to retain customers and attract new ones. This also led to the funds merging, so they could become more competitive. Some of the sickness funds offer perks. Sickness funds choose where they enroll to a specific sickness fund based on their occupation or region. Now Germans can choose where they enroll, and they can change funds on a yearly basis. As a result, sickness funds began marketing themselves in order to retain customers and attract new ones. This also led to the funds merging, so they could become more competitive. Some of the sickness funds offer perks that might seem similar to credit card rewards.
You still can get a bonus for going to the gym, and a bonus for having a checkup. This is in the public system. And if you get a certain number of bonus points, then you get a voucher. But kind of trivial stuff like 200 a year or something like that. 200 euros a year, nothing which is particularly relevant to the person who's paying their 840 a month.
That's interesting, because one of the things that I wondered about, just full on, everyone is, universal healthcare. Everyone chips in. I worry about people. It's easy to say, well, I'm healthy, but health isn't the only thing I care about, I guess. Maybe that's not the best way. It's that I worry about it breeding some sort of resentment about seeing some people partake in certain activities, and someone's a smoker or obese and eating more fast food. And over here, obviously, we don't have great health care, and it's not universal health care. I think the attitude in America, a little bit do with health laws, is just like, you want to smoke yourself to death? Go ahead. You want to eat yourself to death? Go ahead. And it's kind of that, I don't know if barbaric's the word. I think there's an underlying feeling in America ever since the start of, like, you're on your own in a lot of stuff. And that doesn't sound great, but I feel like I'm not making great points here. Just
which is particularly relevant to the person who's paying their 840 a month.
Oh, right. But I was going to say, but at least this system in Germany does give a little perk, however small it might be, to if you are healthy. Maybe now with this system in Germany, you won't really look at other people around you like, ugh, what are you doing? Or something like that. So.
As of 2017, roughly 87% of Germans received their primary coverage through SHI and 11% of the population through PHI. The remaining population, such as soldiers, police officers, and refugees, receive health insurance through specific government programs. All individuals insured through PHI pay a risk-related premium with separate premiums for each dependent. These risk-based premiums mean that costs will increase as the insured gets older. As a result, the government regulates PHI so people don't become overburdened by premiums as they age.
The biggest issue with private health insurance, if you opt out of a public system, is affordability in old age. If you don't impose these, the biggest issue with private health insurance, if you opt out of a public system, is affordability in old age. If you don't impose these financial constraints on the insurers, then the government will be lumbered with a whole lot of old people who reach 85, 90, 95 and are going to be totally unable to pay for their health insurance. So it'll all fall back on the government.
I'm almost at a point here, guys, where like I need to watch this twice. Like I'll wait towards the end. I'm not gonna start over and go back through and start the video over, but a lot of parts in here I thought I understood.
Once someone switches to PHI, they cannot switch back to SHI in the future. But Tanner says there are ways around that.
If you're a freelancer in the private system, you're just going to get a job paying less. There's a threshold. Any employee earning under about 5,000 a month is required to have public. If they earn more than that, they can opt out. So if you are a freelancer, you want to go back into the public system for some reason, then you get a part-time job with a friend.
How is that a loophole? How is that a loophole? You're telling me you can be super wealthy, but want to get the other kind of insurance, right? All you have to do is just get a job somewhere, ask them to pay you like $3 a day or something, and maybe you show up once a month, and that qualifies you. But why can't you just obviously look at this person and be like, well, he makes way more money. It's just that he's trying to go through a loophole here.
Pays you $500 a month for a few months, and then you're back in the public system. So there are ways to do it.
What?
The only reason you probably want to do that, though, is if you have lots of children, because children can be covered free in the public system. In the private system, you have to pay separately for each child.
Germans can also buy supplemental private insurance while staying in SHI. For example, many Germans buy supplemental dental insurance.
The public system pays like for major dental work about half the cost, and then you get supplementary to take it up to 80-90% of the cost.
Germany's system is not perfect. With so many different insurance companies, there's a lot of bureaucracy that contributes to costs.
One of the financial things, thinking if the public system administered by more than 100 organizations called Krankenkasse. Each of those has a head office and a president and a vice president and a financial officer and a whole lot of unnecessary bureaucracy.
This may be one of the reasons that the German system is not as cost-effective as other European countries. More than 30% of both Germans and Americans felt bureaucracy was a major issue in their country's system. Wait times...
I gotta say, UK. United Kingdom. Clearly the NHS is... No system is perfect, but after learning about more countries' systems, how much they pay, how effective it is, good job, UK, it seems.
German system is not as cost-effective as other European countries. More than 30% of both Germans and Americans felt bureaucracy was a major issue in their country's system. Wait times can also be an issue for people in SHI. 37% of Germans cite wait times as one of the biggest problems within their system, while 22% of Americans feel the same.
Generally, I think people are quite happy with the public system. It works reasonably well. The major issue in big cities, I'm in Berlin, Munich, Düsseldorf, Hamburg, it can take quite a while to get an appointment with a specialist. It is the case that the doctors prefer the private patients because they earn up to 3 times more if they see a private patient.
So what can
That's a thing that I feel like is glossed over a lot, and I want to know is that doctors aren't these magical people that were born to be like amazing helpers for a little. Like there are people very smart who clearly went into. I know a lot of them will give the answer like, why'd you go into medical fields, right? And maybe it's true that it's like, oh, to help people, and I'm sure it's part of it. But they're people, and I'm sure the salary from a doctor's salary was, and the prestige that comes along with being a doctor was probably part of it. And I think it's naive to think that the amount of money that doctors are paid won't affect their service. You know, I'm not saying that they'll just be like, oh, no, I'm just going to screw this up, this surgery or whatever. But in terms of the people getting into the field, I worry if public systems over time will make, I could be completely wrong, will make less skilled doctors. I really don't know. I'm just throwing that out there as a maybe. And I'm just curious how, so instead of being offered more money at another private hospital, the government is going to decide their salary in a, I really need to, this is a video where I really need to watch twice.
can the United States learn from the German system? Germany has managed to balance cost controls and universal coverage while also maintaining competition. And Germans generally like their system. In one survey, not a single German said they had to wait more than 4 months for an elective surgery, while 4% of Americans said that they had to wait that long for the same kinds of procedures. And only 7% of Germans said they experienced a
Is this the one place? Oh my God. I'm like, oh my God. The US isn't that bad in one area.
that long for the same kinds of procedures. And only 7% of Germans said they experienced a barrier to care because of cost in the past year, compared
I'm not surprised at all.
to 33% of Americans.
The citizens really like it. They like the fact that everybody is covered. They like the fact that the costs are totally predictable. You know what it's going to cost you and how much your insurance company is going to pay you before you walk in, unlike the United States. They think it's normal that the insurance company pays every claim. They can't believe that an insurance company might deny a claim. And they think it's normal that they get to choose the doctor. They don't understand America, where the insurance company says, we won't cover Dr. Jones, you have to go to Dr. Smith instead. So the main thing I learned in going around the world is you have to make the commitment to provide health care for everybody. That's the destination. It turns out there are many different routes to that destination. I found, the Canadian model, the French model, the British model, the German model. I'm
going to watch the French healthcare after this.
All get to this goal in different ways and different models. So I don't care what the model is. I think it's important that you make the commitment to cover everybody. And this is something the world's richest country has never done.
Okay. Interesting video. Again, I feel like this is something I have to watch all over again. Just because I was confused at a few parts. Firstly being, and one, I want to, thanks guys for watching. If you want to stop there, that's all right. Love y'all. See you guys next time. Okay. But I think that American hospitals are more like luxury hotel or like hotel style businesses where they're looking for the wealthiest people to stay there, and rooms cost a lot. If you don't have enough for the room, it's like, well, you got to get out or, get out of here. There's another paying customer who wants this room. Okay. You need to leave so that, they can clean the room up and change the sheets and get their next customer. And, I think that is an ingrained in society thing. I think America has a much more, you succeed on your own and you fail on your own. You I guess that you go to the family first, and then the neighborhood, and then the town, and then the city, and then the federal government. Whereas something like this, you should really go right to the federal government in terms of healthcare. I don't know enough to say America is as bad as is like the worst kind of first world countries healthcare. I don't know. I don't know a lot of issues in any of these other places, but clearly the infant mortality, the motherhood, the birth what's it called? Childbirth mortality, whether it's the child or the mother, that's crazy. And I was talking to people on Discord a bit, and how it seems like because people are so afraid, such a big problem with American healthcare that I'm learning is the sheer unknowing. People are afraid of the cost, right? And it comes down from childbirth to getting checkups from cancer or something, and that fear of wanting to go to check something out or to go for something where you might be able to be like, oh, I can sleep it off, I can do it here, I'll be fine. I think that results in so many unnecessary deaths just because of the fear factor of having to pay so much money for any given thing. Not everyone knows what is going on in their body, is how serious it might be. So just the peace of mind that a more European-style healthcare system would give, I think, is the greatest thing that it does. Is just, hey, you don't feel great, you don't think it's just the flu or something. I'm not saying you need to go to the hospital every time you get a headache or a stomach ache or a cough. But when it keeps nagging on and it could be something terminal or really bad or something like childbirth, that's just not okay. Just to have the thought in your mind, oh, but wait, think about the bill. Honey, let's just give birth here. Or think about the bill. Maybe it's fine. I don't want to go and see if I have cancer and possibly not have it and still have to pay like $10,000. I think that's the big problem. Anyways, again, I don't know that much about this stuff. I'm trying to learn. I'm saying what's on my mind. I really love to see your guys' comments on these type of videos. And I'm going to do the French one next. Same type of video, but on French healthcare. I'd also like to see what the French and German, Swedish, Dutch kind of gun laws are like compared to the U.S. Because I watched a recent one yesterday, posted it today on UK gun laws. So, yeah, fascinating video. Love learning with you guys, and I'm looking forward to seeing your comments. Bye, guys.